Good morning, everyone. My name is Raymond Blackwell. I'm the Director of Responsive Grants at the Caring for Denver Foundation, and this is our Executive Director.
And I'm Lorez Meinhold, the Executive Director with Caring for Denver. Thank you so much, everybody, for joining us today. We know how valuable your time is and always love to be with you to be able to share more information.
Yes. Today, we're really looking forward to providing an overview of our current funding opportunity, community-centered solutions. We're streaming on multiple platforms today, so I'd like to acknowledge those doing so from LinkedIn, Facebook, or Instagram. We'll use our time today to highlight some important considerations and provide space for you all to ask questions about this call for proposal. Use the chat function to send in your questions. We will be posting your questions on the screen for Lorez to answer. But a little bit more about us before we dive in. For those of you who aren't familiar with Caring for Denver Foundation, we were created by Denver voters to address the city's mental health and substance misuse challenges. We are an independent nonprofit foundation with 3 funding cycles each year: youth, care over incarceration, and community-centered solutions. As part of our ordinance, our commitment to community, we integrate community in every aspect of our work. So what you're seeing in our current call for proposals has been shaped by community voice. Lorez, before we jump into this call for proposals, can you share a quick picture of what it looks like to be in partnership with us if a proposal is funded?
Yeah, appreciate that. And again, welcome everybody who's just joining us. We really see this as a partnership. So you're going to work closely with our team to set shared goals around mental health or substance misuse outcomes. And we're going to check in together during the year to learn what's working, what's changing, what's evolving. Communication is a big part of that. We ask you to stay in touch and be honest with us about what's going on, where support is needed, and in turn, we're committed to being responsive and flexible when changes come up. We know you're experts in your community, in the context you're serving, and our role is to learn with you, share what we're seeing across the field, and help make sure that that collective learning drives change.
Excellent. With that, let's talk about our community-centered funding area. We'll share the link for the call for proposal in our chat. But to start us off, Lorez, what do we mean by community-centered solutions? What kind of programs does that include?
Yeah, appreciate that. We've heard a lot from community about the importance in being in safe and trusted spaces. So this is about delivering mental health and substance misuse supports in the places and with existing relationships people already know and trust. So it's trusted local organizations and or staff that are leading the work. It's meeting people where they're at, not asking them to always go someplace else. But if you are a trusted organization, how do you support them with their mental health and substance misuse needs? A place where people feel respected and safe in their care. They're supported in their transitions. It's culturally relevant. It's identity relevant care. And community is really informing the work and the evolution of that work. And so that's really what it means to be community-centered in this delivery of mental health and substance misuse programs and care.
Thank you. A common question that comes up is how much funding is available. The total amount available for all grant awards in this funding area is $12.5 million. Lorez, can you share some of the themes from community that inform the call for proposals?
Sure. Again, as I said, trust is key. So that demonstrated trust and experience with communities you're serving, staff that reflect the community you're seeking to serve, being able to provide intensive care for those with high needs, supporting, as I said, in those transitions, whether that's between higher level care and community-based recovery, community to community-based recovery, or community to higher level care. We've heard it's really important for a lot of the organizations we support and the people that they're serving that there are opportunities for continued engagement or re-engagement for those participants. A place where really where you and or community values that lived experience, especially the ability to leverage peer specialist roles. And then again, are flexible and responsive to what the community needs. And what I'll say is, again, that 12.5 million, it's as Ramel shared, it's whether it's 1 or 3-year grants.
What are some of the desired impacts or outcomes of the programs we're looking to fund?
Yeah. Per our ordinance, it's about reduced substance misuse, or including that, healthy relationship with substances, that reduction of improved or maintained mental health. And that includes reduced harm to self or others, and then increased equity and outcomes as it relates to mental health and substance misuse outcomes.
I just want to note one more thing before we jump into questions from the chat. If you haven't explored our website, there are two areas that will be really helpful for you. One is the grants resources section, which we will provide in the chat. This has a Word version of the application and templates that you can use. And two, the awarded grants search, where you can filter by the community-centered solutions funding area to see past grants that we've funded. Okay, with that, I'd like to open it up to the chat for questions.
And as you are thinking about those questions, again, we'll sort of give you some deadlines or lift up some of those deadlines. The proposals are due September 2nd by 5 p.m. If you're new to our grant system, you must register by August 31st at 5 p.m. And then you'd be notified mid-November, late November with grants, a start date as soon as December. And I'll say we'll stay on as long as you have questions and want to hear things, and then but we want to make good use of your time as well. So this is an opportunity to ask anything you want.
Looks like we have a question. Is this only for organizations serving Denver?
This is for organizations serving Denver residents. So you have to serve a majority of Denver residents in order to be able to get funding.
Callie has a question. Can you repeat the due date, please?
Yes. September 2nd by 5 p.m. You should see all the dates on the call for proposal. If you go to one of the last pages, it has a little timeline and deadlines. So again, September 2nd is when you have to submit your completed application by 5 p.m. If you have never submitted an application, never registered with Flux with us, you need to do that by August 31st at 5 p.m.
Are there any considerations for grantees who have received a previous grant and are applying again?
Considerations, I'm not quite sure what you mean by that, but what I'd say is, when you're writing the application, we leverage the expertise of community reviewers and others. Don't assume somebody knows exactly all of your work or what you're applying for, so make sure that you help us understand that. Talk about the impact you've been able to have, so some of those measures that maybe you've been talking to a program officer about. But again, as our focus is mental health and substance misuse, so really focusing in on those programs and work that are really supporting community and their healing. Bree, I don't know if that really answered your question. If there's something in particular you were wanting that I did not answer, or Ramel, if there's anything else you can think about.
The only thing I would say, if you have had a past grant with us, being able to talk about the impact that you've had is valuable. There's a section in the application to talk about that as well.
Oh, yeah, go Ramel.
Next question is, you said these are 3-year grants, correct?
They can be either, you can apply for a 1-year grant, a 2-year grant, or a 3-year grant. You really need to consider what makes the most sense for the program that you are applying for.
How often is the reporting process?
Yeah, so usually there is a mid-year check-in, which is a call where you'll get to talk with your program officer about how it's going. Is the work progressing as you thought it would be? Is there any needed changes to the budget, the work itself? And then at the end of the year, there is a written report It's sort of really you're reporting on whatever measures you help develop to show the impact of your work, and it is followed up with a call. So most of our work is, and most of the reporting, or a significant part of the reporting, is verbal, in a phone call with the program officer, so that we can really talk about what's working, what needs to pivot, what needs to stay the same, are we measuring the right things? Ramel, would you add anything to that?
No. A request to repeat the deadlines.
Sure. Again, it's on the last page of the call for proposal, but August 31st is the day you have to register in our Flux system if you're not already registered, but you can do that as soon as today if you want to. But it just makes sure that you're enrolled in the system, and you'll be able to actually submit the grant on September 2nd at 5 p.m. So we do turn off the system, so if it's not in by 5 p.m., we can't accept it. We are a component unit of the city, so this is a procurement period, and so it's a pretty hard deadline. And if you're having any problems with submission, you can always reach out to us.
Our next question is this proposal open to projects that are youth focused?
If the proposal is primarily focused on youth, then this is not the right area to apply for. This is community centered, so you're really serving that whole continuum of community. What I'll say is birth to end of life. Our next funding area is youth, and so that will be open in December, the end of the year. I had to think about that when it gets open. I'm like, wait. And that's really, if you're primarily serving youth 0 to 26, that is the area you should apply for, not this one.
Our next question is, thank you for this presentation. We're just starting a chapter for our work in Denver, so we're in the development phase. Would we be eligible for this funding?
That's a great question. So development can mean many different thif you're still in the planning phase, like this would be a planning grant, less likely we would fund that. If what you're saying is we need to pilot it, but we're ready to start the work, but it's still, we're learning in that start of work, then that might be something that would be more likely to be able to be funding. And what I'll say in all of this is we can never guarantee funding, but again, we are, because there's so much need in community, we were really looking for those programs or projects that are ready to begin serving people in the community.
Can Denver-based MAT programs apply?
Yes. That's an easy question. Thank you.
From Instagram, we have, if our current grant cycle ends before the next grant period starts, can we still apply, or does being an active grant cycle make us ineligible?
No, we let some organizations have more than one grant. So if your current grant cycle ends before the next grant period, if you're in community centered already, it is likely ending the end of November. And then this would start in the beginning of December. If you have a different deadline, this again would start the beginning of December. If it ends later than December, January, February, it's still okay. If you have an existing grant and it's from a different funding area, we would just want to make sure that you're not asking for the same work. So we won't fund 2 grants for the same scope of work at a time. So I probably answered a lot of questions in that one question, because again, as I'm reading the question, I'm trying to understand what the question is. So you can have more than one grant. So if one is still open, it's still okay to apply. It's just, we don't want to have you, if they're going to be overlapping for more than 6 months to a year, we wouldn't want it to be the same work.
Can you give some examples of services this grant may fund, or is open to any avenues for our clients, like housing, clinical services, staffing, etc.?
So this is focused more on the services. So services and staffing. And when we talk about staffing, we're a programmatic funder. So it's staffing and clinical services, or services and resources and programs related to mental health and substance abuse. So we don't typically fund housing. We know that's a social need. We know education and workforce are social needs, but again, having limited resources, we're really focused, and because of our ordinance, we're focused on the provision of mental health and substance misuse, programming, services, and resources.
If some of our residents or students are outside of Denver County, will they still be eligible within this funding?
The answer would be no. So we can only fund residents of the city and county of Denver. So when we say you need to serve a majority, it doesn't mean you have to serve 100% of Denver County residents. Let's say you serve Aurora and Denver, but it has to be a significant number of Denver residents, and any Aurora residents could not be covered under this funding. So you would have to be able to sort of show that this funding went to serve residents of Denver County.
Would funding transportation resources for mental health clients and others in the community be something you would fund? We do education for transit resource and tools, as well as assistance finding rides.
So we sometimes help with the transportation needed to get to clinical resources, not necessarily transportation in general, not general education for transit resources, but it really has to be related to, this is what it's going to take. These transportation resources is what it's going to take to get somebody to their clinical or mental health services, programs, or resources. And Ramel, if ever there's anything you want to add to any of that as well.
If our current grant cycle ends before the next grant period starts, can we still apply, or does being an active grant cycle make us ineligible?
I think we answered this question already.
Here we go. We have a similar one. If you are a previous awardee and get awarded again, would you be working with the same program officer?
That's a possibility. We like to keep consistency, but then we also have to look at how many applications come in and what is that equitable distribution among program officers. So it is a possibility, but it's not a guarantee. And what I can say is Ramel manages an amazing team, and there's a lot of communication among team members. And so even if you don't have the same program officer, the past program officer is always talking to and connected to the current one. Ramel, would you add anything to that?
No.
Okay.
Are there certain approaches to substance misuse that are prioritized? I heard peer support, but are there other approaches that might be seen as more competitive?
Again, we'd want to see the approaches that you're prioritizing make sense for the community you're serving. Mm-hmm. We want to make sure that you're screening people and give them the right level of support. And or if you don't have that right level of support, you're able to get them connected to what is that right level of support. We want to make sure that people can stay engaged in care. So what does that look like? And so, as I said earlier, we recognize that in this space, you all are experts and you understand your community context and the identity of your community. And so we are open to approaches that work best for your community. We just need to see that clear tie to mental health and substance misuse. So it is not necessarily, we'd want to understand also if we're less familiar with that approach, why do you think that will work? What has been that community experience to show that that is that right approach for the community that you're serving? Again, we say peer support a lot. We've seen that work really well for folks when you have that lived experience, they really show that possibility for others to stay in care and stay connected to care. We also know that substance misuse and mental health are connected, and so how are you serving those needs, even if you're addressing that substance misuse side? Ramel, are there other things that you all really think about or look for?
I think at high level, it's understanding the needs of the population you're trying to serve and fitting whatever intervention, and I say that broadly, whatever mental health and substance misuse activity or provision that you're providing to fulfill the mental health or substance misuse need of the population makes sense for them. That's really what we're looking for. And then just lastly, that we would have some way to understand whether or not it fulfilled that need. And so these are the high level what we're looking for. And so if peer support we know is successful in doing that for transitions, for increasing that engagement, et cetera. And so it really comes down to what's the need of the population? How do you effectively fulfill that? Next question. We are a small startup nonprofit and just started our programming. Does C4D suggest waiting to apply until we have direct impact data, or would potential impact suffice?
I think maybe I'll go back to I'll go to the organizational side before the programmatic side. So as a small nonprofit and just starting program, we want to make sure you at least have 1 to 2 year of tax returns. That is sort of more the important part as a startup. If you are brand new in your first year of operations and don't have tax returns, then sort of process-wise, you might not fit. You can always use a fiscal sponsor. If you don't have that, that's really where you're working with somebody that might have that longevity. You don't necessarily have to have direct impact data. We'd have to understand the potential. You would then need to talk about the potential impact. That would suffice. But you'd really have to be able to talk about why you think you would be able to deliver on that, and help us understand how you would lift this up as a new nonprofit and be able to sort of launch that program or continue to do that programming, and what would be, as Ramel said, that potential impact. How do we see it? How are we going to measure it?
Our current grant is 2 years and ends on 3/31/2027. Are we eligible to apply for this September round, or do we need to wait until next year?
So what I'm going to take a bold guess and say is that is a youth grant, just based on where it is. And so you're serving primarily youth. If you are talking about serving youth in this grant, then you need to wait until the youth area. If what you're talking about is serving a broader population, again, older adults, parents, well, not just parents, parents and older adults, or the community at large, then you can apply for this. We would need to see that it is different work than is under your current grant right now. So if you're going to ask us for the exact same work as your current grant, then no, you should not apply for this. If it's different work with different populations, then you can apply. Just recognize that each grant requires its own reporting. So also what makes sense for you as an organization, because then you're also having multiple reporting for the different grants.
Can we qualify this with a fiscal sponsor?
Yeah, if you have a fiscal sponsor, so there are organizations that there's a place for you to mark that you want to use a fiscal sponsor. We'd have to understand sort of your relationship with them. So we'd have to see at some point an MOU, have they been a fiscal sponsor before? There are certain organizations that's what they do as an organization. And then there are other organizations that you partner strongly with. What we want to know is you have a strong relationship with that fiscal sponsor, because technically they're the awardee. They're the ones that are getting the funds, and then you are working with them on that spending of the funds. So so yes, if you have a fiscal sponsor, that's totally fine. We have places in the application to identify that fiscal sponsor, and then there's certain things we'll want to see to understand that relationship with the fiscal sponsor.
Do you all cover peer-led and clinical?
I'm going to put in some words. So we, if you're asking, do we cover staffing? So peers and peer leads and/or clinical staffs? The answer is yes. Do we cover peer-led and clinical services? Yes. There are other words we could put in there, but if there's something more in particular that you're looking for, but again, it's for Denver residents, city and county of Denver only. But we can cover those supports. The other thing I'll just want to make sure that people understand is while we don't have a minimum you have to ask for, a maximum that you have to ask for, we don't want to ever be more than 1/3 of your organizational budget. So that's just going to be important to look at is what is the size of your operational budget, and then what are you asking us for in terms of supporting. We do that partly because that can impact your nonprofit status if we became a bigger or a primary funder of all your services.
The RFP references peer specialists and lived experience several times. Should orgs without peer specialists still apply if their program otherwise aligns with the funding priorities?
Yeah, please apply. I mean, again, peer specialist is one way to address this issue. There are many others that, as long as it's aligned with your community context and sort of the community you're seeking to serve and understanding the intervention. So it doesn't have to be peer specialist. We just, that has been an important workforce that we have supported in this space, but it is not the only workforce that we support in this space. It's not the only intervention that we support in this space. But again, it just has to be tied to mental health and substance misuse, trauma, interventions, supports, and programming. We'll give a few more minutes to see if there's other questions. Again, we stay on as long as you have questions.
Loretta,
Go for it.
I have a question. This is related to earlier with the youth and the student questions and Denver residency. Can you just highlight DPS students?
Sure. Again, if you are supporting Denver Public Schools students in school, we do count all of folks that are served on school as Denver residents. But that's only, in the school year on the DPS campus, a DPS program. And if it's primarily DPS students that you are serving, you should wait and apply for the youth funding area, which is the next one. Again, youth and parents that support those youth and caregivers that support that youth, that is youth, which would be our next funding area. This is really the whole community. But that's really talking about, if you look at the call for proposal, there's a section where we define what it means to be a Denver resident. So if you're also unhoused in the city and county of Denver, you are a Denver resident. If you're in the custody of a parent in city and county of Denver, you are a Denver resident. If you are we do not require citizenship. It's really, again, where you reside, where you live to be served by these dollars. Some of the things we see that we don't fund scholarships. We don't do fellowships. We don't do capital construction or facilities. We do not do general operating costs. So again, we are a programmatic funder, which means we fund mental health and substance misuse programs. And we don't fund programs that require membership in a specific religion or seek to advance a particular religious faith or belief. It doesn't mean that you can't be within a faith-based organization. It just means that the programs and services being delivered you have to take all comers and have to be agnostic to that faith. Ronel, are there other questions you feel like you get a lot?
There's one more from the chat. What is the individual award amount?
That is a question we get all the time, and it's my least favorite question, and I'll tell you why. Probably the average grant size is somewhere around $400,000. Now, let me put the context for that. As I said, people can apply for a 1-year grant, a 2-year grant, or a 3-year grant. Some grants can be 3 years for $500,000. We've had some grants back to the city for $2.5 million for 1 year. And so that award amount doesn't really give shape to the size of the community that's being served, the awardee, or the year amount. So what I'll just say is generally the individual award amount is no more than 1/3 of your organizational budget in a year. So it's individual in the sense of really the size of your organization and the size of your program is really what determines that award amount, in combination with, we typically have received more proposals than we can fund. So in our last funding area, we probably received over 40 proposals for closer to, I want to say, $35–40 million, and we had 14 to give away. The cycle before that, we received over 100 proposals for, I want to say, 50 million, and we had 12.5 to give away. So sometimes you may ask for 3 years of funding, and we may not be able to do 3 years of funding based on the amount of people that are seeking this. So really being thoughtful about what and how much you're requesting, because while 12.5 million seems like a lot, there are a lot of organizations that are in need right now, and there's a lot of communities in need. And so how do you really think about what you're asking for, that size, that request, and what you can lift up in the next year, 2 years, or 3 years?
Looks like that may have been our last question.
All right.
If so, we'd like to thank you for joining this call. You can still ask questions if something comes up after this moment. Just know that a program officer cannot answer it, but Lorez can, and or our Tish from our grants management office can also support you in basic questions as well.
And what I'll just say is how we divide that up. So if it's a question about program or trying to understand it, that would be me. If it's a question about the grant application or the financials, then it's Tish. And you can reach out to us directly. If you do have a grant and you reach out to your program officer, they're just going to send you my way anyway. So just go ahead and reach out to me. What I will say is, again, we're in an open procurement period. What that means is we can't give advantage to anybody around a grant. So if I've answered something on this live event, if it's something about clarification in the call for proposal, I can answer that. If you want to tell me what your program is and say, can we get that funded, or what would make this better, I won't be able to answer that. That doesn't mean you shouldn't still reach out. I will always tell you if I can't answer it and why I can't answer it. But Tish and I are your 2 resources over this until the closing period in September. So feel free to reach out to us. Again, we won't be able to give advantage to anybody, and just really be able to answer within the context of what we've shared. Well, we're grateful to all of you. We're grateful for all the work you do. So unfortunately, we can't always fund everybody that comes in, but we know the work that you're doing is important. So we're grateful for everything you do to support community. We're grateful for the time you spent with us, when we know there's many things you could be doing at this time. And with that, we will let you have some time back. Thank you, everybody.
Thank you.